so excited about today because we're talking about something which is just so relevant for everyone who has a period. We're talking about periods. So we're talking all about your menstrual cycle and what your period might be trying to tell you about your fertility. And we're going to go through 5 kind of top tips of things that you can do to really help optimize both your fertility in terms of your menstrual cycle and your hormonal health. So we're going to talk about Chinese medicine's perspectives as well as kind of medical perspectives on periods and see how that all kind of fits together. So I can't wait. I'm pretty pumped. Okay, so I'm not sure, some of you might not have met me before, but my name is Amy and I am the director at the Acupuncture Pregnancy Clinic in Alexandria. I've been an acupuncturist and a Chinese medicine practitioner since about 2008. And so I have always worked in IVF, fertility and pregnancy support. So that's my real area of interest. And I am also a researcher and an educator. So I've done my own research on integrative medicine practices. I've done research with others about integrative medicine education and practice. I've also been a part of a few clinical trials about the use of acupuncture for IVF, endometriosis and PCOS. And I've presented widely to conferences, to IVF clinics and doctors. I've spoken at hospitals and as well as universities on all of those topics. So I'm really super pumped to be here today to talk to you, which many of you will be our patients or people who are just trying to conceive, looking for some more information. So this Making It on Mondays, it's for mums who are in the making, like people like you, and it's just to kind of give you a bit more information about kind of Chinese medicine perspectives on fertility and things you can do to optimize your fertility. And one thing that people often notice when they come in to see a Chinese medicine practitioner is that they might ask them quite a lot of details about their period, and there might be kind of, so why are you asking me all these questions about my period? Like, most people don't ask a lot about each other's periods. And in that kind of health consult, sometimes people are like, I'm not sort of sure why you're asking me this. So today I think you're going to get a much kind of larger sense on why we ask you about your period and why it's important from a Chinese medicine point of view. So let's get started. So we're going to talk today, we're going to talk about what your period is. What is it? And then what, the flow, whether it being heavy or light, or if you're getting clotting or pain, and what cold uterus is. We're going to talk about all these things from both a Chinese medicine perspective, and we're going to throw in some sort of tips that you might want to discuss with your doctor. So let's get started. So first we're going to talk about what is your period. So we all know that your period is what you get every month and it makes you a bit grumpy. Your partner knows about it. And apart from that, we know that if you're trying to conceive, it's often a really disappointing day when, that day 1 and day 2. But we also know that what the period is essentially, it's the lining of the uterus, which is called the endometrium. So I'll refer to this a lot. It's the endometrium, which falls away when all your hormonal levels drop because a pregnancy hasn't occurred. And this endometrium is actually where the embryo would be implanting if the pregnancy was successful that month. And what we know about endometriums, in order for them to be really good quality and ideal, awesome homes for little embryos, what we want them to be nice and thick, we want them to be spongy and vascular, and we want them to be kind of nice and even. So why am I telling you this, and what has this got to do with periods? Is because when you get your period, you're looking at the endometrium, and so it can give us really good clues about the quality of the endometrium, how well it's formed, and it's also going to give us some really good kind of telltale signs about what's going on hormonally. So we're going to talk about that. So to start with, the number one thing that you normally will be asked about your period if you come and see a Chinese medicine practitioner is do you have a heavy period or a light period? How would you describe it? And so a heavy period usually is defined someone who needs to change their pad or their tampon, every hour and maybe every 2 hours, but they need to change it very frequently, and they may have like breakthrough bleeds. And also from a medical standpoint, if you're getting any clotting that is 50 cent size or larger, then that is also a heavy, like that's defined as a heavy period, or if it goes for more than 8 days. So if any of those things are you, then let me know, and we're going to give you some real information about all of that. Oh, I'm just realized I can scroll down and see the comments. That'd be nice. So yeah, so your period, comes along day one, and if it's very heavy, then you might need to, be changing things quite a lot, which isn't much fun. And so what is that telling us? So if we heard from that, the number one thing we're probably going to ask you if you talk to your doctor about it, because this can indicate a couple of things that we want to know. So the first thing is that it can indicate that your iron levels are a little bit low. If your iron's low, unfortunately, the body, it doesn't do a very good job of kind of self-regulating. And so if you've got low iron, then you often will keep bleeding more. So you'll bleed heavily, your iron will come lower again. It's sort of a vicious cycle. It doesn't self-correct. So that's one thing we want to check is like, are your iron levels okay? Particularly if you're having heavy bleeds, then you're going to be losing quite a lot of blood. The second thing we want to find out is there potentially something else like a bit more serious going on? And we're thinking things like polyps or endometriosis. And we want your doctor to investigate and make sure that, nothing untoward is happening there. All right, so that's heavy periods. From a Chinese medicine point of view, you're going to have a heavy period if you have your blood deficient or blood stagnation. So these Chinese medicine, we're going to talk a lot about blood deficiency and a lot about blood stagnation. But we're talking about blood deficiency. We're talking about not over like the quantity of the blood, but we're talking about the quality. So then again, that you can see how that sort of ties back the quality, like iron levels may be a bit low, and then hormonally things can be a little bit unbalanced. So the quality of the blood is often got to do with both hormones and the nutrient level. And then we're also talking about the quality, like how much you've got pumping around or in that area, for example. So again, now conversely, a moderate period is more like you're just needing to change every kind of 2 to 5 hours. That's required, like it's normally moderate. It's normally like 3 to 5 days in length. So it shouldn't be any big deal, and that's ideal. So we're not going to really talk too much about that because ideally everyone has a moderate period. But we are going to talk about light periods and what that means. So a light period is defined like when you only need to really change every kind of 3 to 5 hours. You don't need to change. You only need to change a pad or a tampon once or twice a day. That's a light period. Also, if the blood is kind of quite pale in colour, that can be indicative of quite a light period. And the reason why that is important is because the endometrial tissue that we talked about earlier, that is that nice place that we want an embryo to implant. If you're having a light period, this can indicate that your endometrial lining may be a little bit thin. And so what is that caused by? From a medical point of view, having a thinner lining or a thinner period, sometimes one thing you want to check out is your estrogen levels, because the estrogen helps build, in Chinese medicine, it builds the blood. It's like a real blood. It builds the blood and it builds the eggs and also builds that endometrial lining in that follicular phase. So from when you start your period to when you ovulate, that's when it all starts to begin to build. So if you've got a light period, the first thing we'd say, have you had any testing with your doctor? And we'll be looking at like maybe a day 3 test to look at your baseline hormones. And then we'd also be wanting to see, double check that you actually have ovulated. So that would be like a day 21 progesterone test, which shows us when the progesterone levels get nice and high, we know that you've ovulated. Okay. So that's heavy or light period. The light period from a Chinese medicine point of view, again, has got a lot to do with the blood deficiency. And so in the case of blood deficiency, we're really looking at how we can kind of build the blood. We want the quality of the blood, so like the hormone levels and the nutrient levels to come up, and also the quantity and where it's circulating. So they're all the things we're thinking about. And we're going to get a bit more into that when we go into our 5 top tips on how to improve your hormonal health and menstrual health. And so the next one I'm going to talk about is the quality of the bleeding. And this is things like if you've got clots or if you have kind of mucousy, stringy parts in your period, then this is an indication with the clots that there's some blood stagnation. So that lining, again, to the endometrium isn't forming as smoothly as it can, or perhaps as it should. And so it was potentially like an uneven and not as a smooth area for the embryo to implant. So what we want to look at is how that we can reduce the unevenness of the endometrial lining. And so that is what we call blood stagnation. We're going to talk a bit more about what we can do for blood stagnation in just a few minutes. And then the third thing I really want to touch on is what we call cold uterus. So often people will come into me and they go, I've been told like by another Chinese medicine practitioner, I've heard of this thing on the internet called cold uterus. And you know, what's cold uterus? So in Chinese medicine, they talk about a need for the uterus to be really nice and snug and warm, and for implantation to be able to occur. And I've just got a message from Lou, the light period. Hopefully I've answered that question for you, Lou. And sorry, where was I? I've just lost track. Warm uterus. It's really important that it's nice and warm. And we know, like, if you look at like modern medicine, and if you've progesterone is a very, very warming hormone. And if you've ever done base body temperature tracking, you'll see that after you've ovulated, your temperature goes up because of the progesterone levels. So even from a medical point of view, it's really important that there's like an element of warmth in your body. And in Chinese medicine, it's super important. Like, we're all about the warm uterus. So often your practitioner will tell you, if you can, to keep your feet really warm. And this is because all the meridians that run from the ovaries and the uterus, they actually start at your feet. So if you can keep your feet super, super warm, then it's going to be really helpful in keeping like all that energy and blood flow to the uterus happening, and really great. So you have a nice warm uterus, and we don't want cold uterus. So let's see. What are the like top tips you can do to help improve your hormonal health? Well, number one, what we want to do is make sure that over the period time, you keep this area super duper warm. Like, it needs to be toasty, toasty warm. Keep your feet nice and warm. You can do a hot foot bath. I've got this great info I can tell you all about in terms of hot foot bath, keeping that real warm. Keeping the abdomen super warm. So putting a heat pack on your lower abdomen, or, you know, on the back, and doing that at night and during the day, during your period. And this is going to help you if you've got blood stagnation, cold uterus, or even blood deficient, because what it's going to do is really help encourage lots of blood flow to the uterus, and lots of warmth in that area. And that's what we want. We know that warmth helps encourage blood flow, and cold congeals. So that's why we really want to keep away from this kind of colder energy, and we want to really make sure the uterus stays super duper nice and toasty warm, so that little embryo can implant nice and happily. And then, so let me just get to my notes. Number two, the thing we want to do is eat really warming foods. So again, we want to put like lots of warm food and warm energy into our body. So that means cutting out, particularly over your period time, but in general, if you're blood deficient, blood stagnation, if you think any of these things apply to you, then you really want to eat lots of warming, cooked, nourishing foods. And, you know, this is things like well-cooked soups, well-cooked meals, no smoothies and no salads, I'm sorry, particularly around period time. And you want to eat lots of blood nourishing food, particularly if you think you're on that kind of blood deficiency side of things. So what is blood nourishing food? Well, it's all things like meat and eggs and chicken and bone broth, lots of veggies, and things that are actually really high in amino acids, which is my number 3 tip. So there's been quite a bit of research recently about not only like the gut microbiome, but also the the uterus microbiome. And so we know that like the health of it is really important. So there's a few things that we can do to improve like your uterine microbiome. And they really correlate with some of the things which are going to be really helpful in terms of in providing nutritionally all the building blocks for a really good endometrial lining. And so from a medical point of view, amino acids are really important to help with that endometrial lining. So they are super helpful, and they are very similar to the blood nourishing foods in Chinese medicine that we talk about. So things like, again, like high amino acids is fish and chicken, eggs, lots of seeds, nuts, legumes, quinoa. This is all kind of really high amino acids. And also to create a good uterine microbiome, lots of fresh fruit, vegetables, eating really clean is really important, as it would be like think about what you do for good gut health. And also, if you've had antibiotics, to be maybe talking to a naturopath or taking a probiotic and making sure you've got lots of good bacterias, not too many of the bad, and if you have, just really balancing that out. So that's our tip number 3, to make sure your diet's full of heaps of amino acids to really help nourish the endometrium, really help nourish the blood and get those kind of building blocks for estrogen and building blocks for building up that endometrium layer. So number 4 is a little bit controversial, and this is probably the thing I find a lot of patients struggle with, and it's rest. So often, particularly if you've got a light period, the first thing we're probably going to ask you a little bit about is what you do in terms of exercise. Because we know, like we've probably seen it from athletes, women athletes, when they work really hard, when they do a lot of physical exercise, they actually start losing their period. And that's because the estrogen levels start becoming low. And also the reproductive system, it only really likes, it's kind of like a reservoir of energy, and it only will kind of go if you've kind of got enough juice in the tank. If you're working out really hard, if you're just working really hard in general, then it's going to be one of the first things that's going to sort of start to close down, because your organ health, other organs are more important than your reproductive system in terms of survival. So it's really important that people, if you're trying to conceive, that you rest. And there's actually been research to come out to suggest that high intensity exercise, more than like once or twice a week, even moderate amounts, seems to impact negatively on fertility. But I'd say particularly if you have a light period, then you're someone who probably wants to look at a maximum doing high intensity exercise maybe once or twice a week, and for 20 or 30 minutes. You really want to reduce that high intensity exercise, and instead I think doing some really lovely, nourishing, gentle yin yoga, doing some other gentle yoga, going for walks, doing things you enjoy. You can still move, but we don't want to exhaust you. We want the blood not to be going to the muscles. We want the blood to be going to the uterus, to nourish the uterus. Okay? Yeah. So that is probably the tip number 4 to having really good hormonal health. And this is really important, particularly at the period time. So over period time in Chinese medicine, they sort of blanket say, no exercise, blanketly say, no swimming, don't let the area get cold, warm socks, like they're very protective, because they see that over the period time, the uterus is very open and very vulnerable. And so it's a time you need to really kind of protect and conserve your energy in order to make way for another menstrual cycle. Because you're right at the very kind of start of your menstrual cycle around period time. And it's even when you're still bleeding, you're beginning to reform the endometrium and the eggs for your next cycle. So it's the reset, and it's in Chinese medicine, it's the most important time in terms of what influence you can do for someone's cycle. So I love it when people come in between day one and say 3 or 4, because I know they're right at the start of their cycle, and the acupuncture we're going to do they're going to get the best bang for buck. And that actually brings me to number 5, which is what you can do to help with your menstrual cycle and hormonal health. And that's come in for acupuncture, and particularly around period time, that first week of your period, it's a great time to come in, and we can really kind of like work on nourishing your blood and work on encouraging lots of blood flow to the ovaries and to the uterus, and really work on, trying to really juice up all your hormones for that cycle. Also, if you think you might have like a cold uterus, then you get cold in that area, then that's a really great time. We can try and expel the cold from the uterus. So we do more points to encourage lots of blood flow and warmth to that area. And if you're someone who's blood deficient, then it's a time we're really going to try and kind of start really juicing up your cycle and nourishing the blood from that point forward. So there has been some research around, acupuncture in terms of blood flow to the uterus. There was one study that after 8 treatments, that it showed improved ovarian blood flow, and this was maintained 4 weeks after. And there's been other studies that have shown that acupuncture can help improve menstrual regularity and improve like the hormones around your menstrual cycle, augment them overall. But if you want more information about research, I'm a bit of a research nerd, so I'm happy to share with you more. But I just wanted to give you guys some like really kind of general tips. So just to quickly backtrack, quick recap. If you think your periods are heavy, go and see your GP. You want to check your iron, and you want to make sure that they do investigations, you've got no polyps or endo. If you think that your periods are light, again, I'd say see your GP, and you just want to check your estrogen levels and make sure that they are good, and also make sure that you're ovulating. So they're kind of like the key ones in terms of going to your doctor. In terms of Chinese medicine advice, we want to make sure that you're keeping the area super warm, no swims, nothing cold, and you are over your period time, you're resting, you're taking it easy, you're sleeping, you're not going to hit classes, you're not doing a run, you're just chilling out, you're having a lovely, lovely time, enjoying it, watching Netflix or whatever you like to do, reading. And then we want you to eat lots of warming foods, lots of spices that are warming, like cinnamon, cloves, chai, to help warm and encourage lots of blood flow, both during your period and over that whole menstrual cycle, but during your period is very important. Ginger, love ginger. And lots of blood nourishing foods, which are also amino acid, high in amino acids, so things like eggs, fish, meat, bone broth, and veggies, quinoa, legumes. Try a hot foot bath. I've got excellent tips on how to do a hot foot bath if you want to know. And what else have we got? See a naturopath if you think you might have microbiome issues with your gut. They're great at helping sort all that sort of stuff out. Get in touch with us if you want to know who to see. There's amazing naturopaths and nutritionists in Sydney. And yeah, acupuncture and herbs can really help. We'd love to hear more comments and questions, and yeah, please let us know if there's anything else we can help with. Just tag either Louise or myself, and if you want any more information, just write us a comment, or you can write us a message if you would like. I've got awesome handouts on dietary advice for blood deficiency, dietary advice for blood stagnation, dietary advice for cold, and if there's anything at all you'd like to know more about it, get in touch with us. And we're looking forward to seeing you again next week for our next Making It on Monday weekly workshop for mums in the making. Next week's going to be with Lou, and she's going to be talking all things mindset, and so how a mindset can really help if you're on your fertility journey. So it's going to be a great one. Don't miss it. Anyway, my name's Amy. It's been great being live here today. I hope it's helped, and yeah, get in touch if you want any other information. All right, have a great day, everyone. Thanks. Bye.